Many owners only realize it too late, but would you know how to identify the real symptoms of tick disease? This serious disease is often confused with simple signs that go unnoticed in daily life. Today, you will discover, in detail, what the symptoms that really matter are, and how to recognize them early, because this information can literally save your pet's life. Tick disease is not a single condition, but rather a set of serious infections caused by protozoa and bacteria that are transmitted through the bite of these small parasites. The two main forms are ehrlichiosis and babesiosis, both with fatal potential if not detected in time. What makes this disease particularly dangerous is that the initial symptoms can seem like minor problems, leading many guardians to postpone seeking veterinary help. Early detection is not just important, it is crucial to avoid complications that can lead to the animal's death. We are going to talk about 7 main symptoms, but it is important that you know from now that the 7th symptom we will address is the most serious of all. When seizures or tremors appear, this means that the disease has already reached your dog's nervous system, and every minute counts to avoid permanent sequelae or even the loss of the animal. Fortunately, there are other signs that appear before, and recognizing them can prevent your pet from reaching this critical stage. The reality is that millions of dogs around the world are exposed to infected ticks every day, especially during the warmer months when these parasites are most active. The incubation period of the disease can vary from 1 to 3 weeks, which means that your dog may appear completely healthy for days after being bitten, only to develop severe symptoms apparently suddenly. This silent time window is precisely what makes attentive observation of your pet's behavior so fundamental. Before we start explaining each symptom, please leave in the comments your name and the city where you are watching our content. This helps us a lot to understand our audience and create increasingly relevant content for you. Symptom 1. Persistent fever. Fever is frequently the first sign of tick disease, but it is also the most difficult to be perceived by guardians. Unlike humans, dogs do not show fever in an obvious way, and many owners have never measured their pet's temperature. The normal temperature of dogs varies between 100 and 102 degrees Fahrenheit, and when infected by tick disease, this temperature can rise to 104 degrees or more. The problem is that externally, the dog may just seem a little quieter than normal. The fever appears because the immune system is fighting against the microscopic invaders that entered the bloodstream. During the acute phase of ehrlichiosis, which can last from 2 to 4 weeks, fever is one of the most consistent symptoms, but is rarely accompanied by other clear signs in the first days. Many guardians assume that the dog is just lazy or tired due to the heat, especially in warmer regions. The impact of continuous fever on the dog's well-being is significant. The animal's body is spending an enormous amount of energy to combat the infection, which explains why many dogs become sleepier during this period. Persistent fever can also affect appetite and interest in normal activities. If you notice that your dog is quieter than usual, especially if this persists for more than 2 days, consider measuring its temperature with a rectal thermometer specific for pets or seek a veterinarian immediately. Symptom 2. Apathy and weakness. A sudden change in behavior is one of the most revealing signs of tick disease, but also one of the most misinterpreted by guardians. Apathy and weakness appear frequently during the acute phase of the disease, when the dog's organism is being attacked by parasites that multiply rapidly in the bloodstream. The difference between normal tiredness and the real loss of vitality caused by the disease is subtle, but important to recognize. A healthy dog that played a lot during the day will rest, but still responds to environmental stimuli, like the owner's arrival or the noise of food being prepared. A dog with tick disease demonstrates a worrying indifference to situations that would normally make it excited. It may remain lying down even when called for a walk, or may get up with visible effort. This weakness happens because the parasites are directly attacking the blood cells responsible for transporting oxygen through the body. When red blood cells are destroyed, or when platelets decrease drastically, all organs receive less oxygen, resulting in this sensation of extreme exhaustion. The consequences of not investigating this weakness early can be devastating, as the dog can progress rapidly to more severe stages of the disease, where recovery becomes much more difficult and expensive. Symptom 3. Lack of appetite and weight loss. Food refusal is an alarming symptom that appears relatively early in the tick disease process. Infected dogs frequently present anorexia and weight loss as initial symptoms, and this is not just a matter of decreased normal appetite. The animal can reach the point of completely rejecting even its favorite treats. The relationship between the disease and food refusal is complex. On one hand, fever and general malaise naturally decrease interest in food. On the other, parasites are causing inflammation in various internal organs, including the liver and spleen, which can generate nausea and abdominal discomfort. Some dogs may even present vomiting, which further aggravates the nutritional situation. Weight loss becomes visible in a few weeks because the animal's body is spending extra energy to combat the infection, at the same time that it is not receiving sufficient fuel through feeding. Severe weight loss is common in cases of long-duration ehrlichiosis and can be one of the first visible signs that alert the guardian that something is wrong. When weight loss becomes evident, it generally means that internal organs are already being significantly affected by the disease, making treatment more urgent and complex. Symptom 4. Unusual bleeding. Bleeding represents one of the most frightening and dangerous symptoms of tick disease. Bleeding problems occur due to the dramatic drop in the number of platelets, the cells responsible for blood coagulation. These bleedings can appear in various forms, from spontaneous nasal bleeding to small purple or red spots on the skin and mucous membranes. The nose bleeding without apparent reason is a maximum alert sign. Unlike bleeding caused by trauma, this type of hemorrhage happens spontaneously and can be difficult to stop. Purple spots, known as petechiae, appear especially on the dog's belly, in the mouth mucous membranes, and on the gums. These spots are actually small bleedings under the skin, caused by the lack of sufficient platelets to maintain the integrity of blood vessels. The difference between isolated bleeding and a recurrent pattern is crucial for diagnosis. A dog that gets hurt playing may bleed occasionally, but when bleeding repeats without apparent cause or takes too long to stop, this indicates a serious systemic problem. During the subclinical phase of ehrlichiosis, the only sign may be prolonged bleeding after blood collection for exams. The risk of serious complications when blood does not clot well is immense, as even small wounds can become medical emergencies. Symptom 5. Eye changes. Eyes are windows to the internal health of the organism, and in tick disease, they frequently show concerning signs that should not be ignored. Ocular problems, including hemorrhages and even blindness, can occur in cases of ehrlichiosis, especially when the disease progresses to more advanced stages. Ocular redness appears due to circulatory disturbances caused by the destruction of blood cells. The small blood vessels in the eyes become more visible and may even rupture, causing hemorrhages that leave parts of the white of the eyes reddened. This should not be confused with simple conjunctivitis, as it usually comes accompanied by other systemic symptoms. Yellowed eyes are a direct reflection of liver problems. When this organ cannot adequately process the massive destruction of red blood cells caused by parasites, bilirubin accumulates in the blood, giving a yellowish coloration to mucous membranes, including the eye conjunctiva. This sign, known as jaundice, indicates that the disease is already affecting multiple organic systems. The presence of increased ocular secretion or excessive tears can also signal internal inflammation. These ocular signs serve as an additional alert that the animal needs immediate veterinary attention. Symptom 6. Vomiting and diarrhea. Gastrointestinal problems are frequent manifestations of tick disease, but can be easily confused with simple alimentary disturbances. Vomiting appears as a symptom in cases of babesiosis, especially when the disease affects multiple organic systems simultaneously. The frequency and intensity of these symptoms during tick disease differ significantly from common digestive problems. While alimentary indisposition usually resolves in 24 to 48 hours, vomiting and diarrhea caused by tick disease tend to be more persistent and may progressively worsen. Vomit may contain bile or even blood in more severe cases, and diarrhea may present dark or bloody coloration. The crucial difference between passing malaise and something persistent is in duration and response to basic treatment. A dog with simple alimentary indisposition generally improves with fasting and light diet, while an animal with tick disease does not respond to these simple measures. The consequences of continuous loss of liquids and nutrients are serious, as they can rapidly lead to severe dehydration. When combined with the food refusal that we already mentioned, this additional loss of fluids can drastically accelerate the deterioration of the animal's general state, creating a medical emergency that requires immediate intervention. Symptom 7. Seizures or tremors. This is perhaps the most serious and terrifying symptom of tick disease, indicating that the infection has reached the central nervous system. Neurological disturbances, including lack of coordination, depression, partial paralysis, and increased sensitivity to touch, can occur when the brain and spinal cord are affected. Not all cases reach this point, but when it happens, it represents a situation of extreme urgency. Seizures related to tick disease can vary from small localized tremors to generalized convulsive episodes. This happens because parasites can cross the blood-brain barrier and cause direct inflammation in nervous tissue, or because toxins released by organisms affect the normal functioning of neurons. Some dogs may also develop meningitis, an inflammation of the membranes that surround the brain. Neurological signs observed in severe cases include loss of coordination when walking, as if the animal were staggering or drunk. The dog may present head tilting, involuntary eye movements, or even temporal loss of vision. Increased sensitivity to normally painless touches can also occur, making the animal react exaggeratedly when touched. This is a maximum alert stage that demands absolute urgency. When neurological symptoms appear, each hour of delay in treatment can mean the difference between complete recovery and permanent sequelae, or even the animal's death. The guardian's responsibility goes far beyond observing these symptoms. It is fundamental to understand that only a qualified veterinarian can make the correct diagnosis of tick disease. The signs we described can appear in isolation or in combination, and their intensity can vary enormously from one animal to another. Some dogs may present very subtle symptoms at the beginning, while others rapidly develop a severe condition. Definitive diagnosis requires specific blood tests, which can detect parasites directly or identify antibodies that the organism produces to combat them. Tests like SNAP4-DIX can detect antibodies for different types of parasites transmitted by ticks, But the interpretation of these results should always be left to a veterinary professional. Ticks are small, but the consequences of the disease they transmit are gigantic. These minuscule parasites can carry microscopic organisms capable of devastating a dog's health in a matter of weeks. Prevention continues to be the best strategy through regular use of anti-tick products and frequent inspection of the animal's fur, especially after walks in areas with vegetation. If this content was useful for you, like this video and share it with other dog owners. Information can save lives, and the more people know how to recognize these symptoms, the more animals we can protect. Leave in the comments if you have already gone through some experience with tick disease, or if you have doubts about prevention. Your participation helps us create even more complete and useful content for our entire community of pet lovers.